This is an ultrasound examination of a 30-year-old patient. This is an interesting case of transition from diffuse hyperthyroidism, known as Graves' disease, to hypothyroidism. The antithyroid medication was discontinued several months ago. However, a significant excess of TSH receptor antibodies remains in the blood. Free T3 and T4 levels are normal, and TSH is 54. The patient feels well. Note the predominance of isoechoic thyroid tissue and the slightly increased blood flow. As can be seen, the hormone-producing tissue is sufficient to supply the body with a normal amount of thyroid hormones. Moderately hypoechoic segments of medium size are visible in the left and right lobes of the thyroid gland. They are visible in two projections. We specially measure some of them. However, they are not nodules. It is important to recognize and distinguish nodules from the segmental process in the thyroid gland. In Doppler mode, with basic settings, the vessels leading to these segments are visible. In particular, slightly active blood flow is noticeable at the edges and within the alterated segments. The approach of vessels to the segments is especially noticeable as sensitive settings, that is, with a decrease in the impulse repetition rate. You should understand that nerve fibers from the autonomic nervous system nerve cells approach the segments along their vessels. The summation of nerve impulses from 2-3 groups of nerve cells leads to increased tension in individual segments and their vascular network. Reducing this influence will later contribute to a decrease in the functional tension of the tissue in such segments and a normalization of their condition. This can occur relatively quickly, for example, within a few months. Accordingly, thyroid nodules undergo change much longer, usually over years. Peak blood velocity in the thyroid arteries is also slightly increased. All this indicates a favorable prognosis. Please refer to the sections of Doppler sonography, thyroid segments, and nervous regulation of the thyroid gland on our resource, urisThyroid.com.